Oh Lord, we can got a feeling so fast and my God said something yesterday.
feeling today?
Fine.
Any pain?
No.
Any nausea or vomiting?
No.
Fatigue?
A bit tired, but no, not really. Nothing unusual.
Numbness or tingling?
No.
Shortness of breath?
No.
Cough?
No.
Mouth sores?
No.
Diarrhea?
No.
Constipation?
No.
Any rashes on the skin?
No.
Swelling?
No.
Or bleeding?
No.
New known allergies?
No new allergies. I should still have latex and lactose listed.
But anything, nothing new?
Nothing new, no.
Medications are up to date?
I believe so, yes. I think I got everything up to date with that earlier this month.
Okay.
So it should be fine.
Let's get one arm out for your blood pressure.
Oh.
Have you had the pneumonia vaccine?
No, I still need to get that.
What about the flu shot this season?
Does it say I have the flu shot? I got.
Yes, it does.
Okay, then I got it. I wasn't sure if I got that or not. In November.
Yeah, it was November.
Okay, then I have that one. I haven't gotten the pneumonia one yet. They spoke to me about it, but I think that one was put off until today.
Okay.
Alongside blood work that I need to get done for neurology.
Okay.
That I don't know if the orders are in for that, but he said that would be done at my next appointment, and that's been having difficulty with that. And usually we get my blood work done on the same day I have oncology anyway.
Okay.
So is there any way for you to like see the previous blood work done and like just reorder that?
So the doctor has to put in orders.
Okay, and it doesn't show any orders?
I can check your order. What were you supposed to have?
I have no idea what the tests are called or anything, but it was just...
Who ordered it?
Dr. Oncologist. It would have been like... I'm not really sure like what it would have been. It was always very extensive. And I have to have it done every 6 months minimum. For my liver. And usually I have it done here if like the appointments would line up. And he told me to wait off on it 6 months ago until now. But I didn't know what was happening with that.
Yeah, I don't see any orders. I don't see anything. Not for like blood work. I see imaging.
When was that?
This list is... Yeah, I just see... The only thing I see the last time it was a lab order was November 21st. But the most recent thing was January 3rd, which was dicyclomine, which is the oral medication. Were you in the hospital?
Oh, no, that's my normal.
Okay. So that's all I see. I don't see anything else. So maybe you can talk to Dr. Boulmay when he comes in about it.
Yeah, maybe maybe the November one was what he was putting the orders in. If those are still current, then maybe I can get that done using those. I'm not sure.
The November one says it was completed.
Oh. Oh, maybe I had that done in my primary care visit. That must have been what he did.
Let me get your temperature across your forehead, okay?
That's a new one. It rolls. The rolling ball one. That's cool.
And quicker.
Yeah. Okay, thank you.
You're welcome.
Oh, hey.
How you doing?
Fine.
You look like you're dressed to do something important.
No, I'm cold. It's just very cold.
Hmm.
It's just January and it's cold. And like I tried to wear warmer like shoes and socks and well, I guess my socks are kind of mixed. They're the same socks, but they're mismatched.
It's kind of a cool
and
look.
It's just cold.
Yeah.
Like it like I'm it was fine in the waiting room, but I don't know, maybe I've just gotten a bit tired, my medicine wore off and now I'm even colder.
Yeah.
Yeah, but it's pretty tough for me in the winter usually.
You must have been tortured during the snow, huh?
It was really hard.
Yeah.
I was standing up a lot. I was just trying not to have a seizure. Honestly, that was what my goal was. I got through it, but because I got prepared, my father came over like right before the freeze happened.
Yeah.
Right, like that weekend before that, I was like almost catatonic. Because that sometimes happens with the changes in pressure and stuff. I've always had issues with that since my tonsils adenoids were taken out when I was, an infant and stuff. Since I was born so premature, I've always had to keep big issues with pressure changes. And because of where we live right by Lake Pontchartrain, and I'm even closer now since we bought a new property.
Okay.
So like I'm right by the lake basically. So like when the temperature has those like massive shifts, like the water level will drop like like 50 feet, and so it'll be people can pass out, and so I was just like asleep, and like not asleep in like a good way. I was
right. You were
like,
just out of it.
Like probably like 24 hours plus of sleep total, and I don't even know if I was in bed. I may have been like halfway on the floor or something.
Yeah.
And like, but he left like notes that like there's a freeze, like you gotta keep the water running and stuff.
Yeah.
And because of that, I was like more prepared than usual, and so I was like, I think more on top of it this time.
Got it.
I just got lucky. There's been times in the past where it's been really bad, but this was a pretty good year comparatively. I got to like see the snow and everything.
Yeah.
And
that's unique.
And that was unique. Yeah. That was kind of cool. There was a lot more snow this year where I live now than in Beauchene with my parents' house that I've grown up on. Sometimes there's been snow there.
Yeah.
But it's not maybe close enough to the lake.
Yeah, this was like a foot deep down here.
Oh yeah, it was
insane.
It was like 2 or 3 feet. Like the from like the foundation or like lower than the foundation.
Yeah.
All the way like up above like the patio.
Yeah.
In the back, like it was so much snow that it was like, okay, this is gonna damage the buildings amount of snow.
Yeah.
That's how much snow it was. It was that much water.
Right.
Like it was like halfway up the air conditioner.
Yeah.
That was on the ground level. It was pretty crazy.
Well, how have you been feeling physically other than the weather changes? How's your narcolepsy been?
Depending on the consistency of the medication that I've been able to get, in the last year it's been not good. I'd say like there was months and months where like there was just not this past year as in the past with shortages, but more so just like this. I don't know if the state was being a pain or something.
Yeah.
But there was a lot of pharmacy changes with like legal things, I think, with Medicaid or like them being a problem to Medicaid.
Okay.
And then the feds not liking that at all, and that seems to be all worked out by now.
Okay.
So that's not as really an issue, but like they were like making the pharmacists like not do something or something like that, and I had to switch over all my prescriptions from Walgreens because they were just not really capable of handling the things. Maybe they're too big of a corporate structure, so they kind of just didn't want to deal with the little like short-term
we
issues.
deal with that with cancer drugs all the time.
It was exactly like that because I dealt with that too with my interferon and them shipping it to my house and stuff like that when I was 10. It was the first time I really experienced it, and it felt just like that, and I was just so done with it. And then but this time it only lasted like maybe 2 or 3 months. You know what happened? It started in like June, and that was exactly when it started with my treatment.
Yeah.
So it's like always, whenever that happens for the, the chemotherapy and stuff, it seems like it happens at the same time every year. I don't know if that's when they do certain changes, but that's what I dealt with this past year. but the last like 4 months, I think I've had very consistent access to
Okay.
my medication.
Anything other physical?
Besides the valproic acid for
Okay.
the epilepsy, that's been still an issue. Dr.
Okay.
Lundrick has not been able to get that worked out because that's more like a problem on my end, I
Okay.
think. But I contacted my insurance, and they still are not able to get a 90-day supply.
Okay.
And I'm supposed to be on a 90-day supply so that I don't keep having this like week of withdrawal from it, because
Okay.
that's very dangerous, and especially like if I didn't get it right away this past month,
Yeah.
during that freeze, I would have had constant grand mal seizures.
Yeah.
And that would have been really bad.
Yeah.
And so like I'm gonna run out of it again in like 2 weeks.
Got it.
And that's a huge issue with ordering it, because it's not, they don't just like have it in stock always.
Yeah.
So it's like, it seems like it's harder to get a 30-day supply of that sometimes than it is to just get enough of the Adderall, and the Adderall's always out of stock everywhere. Yeah. It just because the valproic acid just isn't used that much.
Yeah.
And that's why they want me on that 90
It's funny,
days.
even very commonly used drugs nowadays, it's hard to get. Like, this is maybe not quite a similar story to yours, but our dog has seizures, and we had to get phenobarbital for it. The price from December to January doubled, and apparently that's like a global thing for humans too. The phenobarbital generic has doubled in price, which is crazy because phenobarbital and valproic acid, all those drugs have been around for
like
decades, literally decades.
Yeah, like probably like the extent of your life almost.
Yeah. Oh, for
like,
sure. Yeah, absolutely.
I mean, how Dr. Lundrick explained it, it sounded like valproic, looked like his residents and stuff hadn't really heard of it that as much.
Yeah.
But like, you know, I was like expecting, oh, well, that's normal. He has such a massive wealth of knowledge, practically being their founding part of that part of neurology, that I would have expected them not to know about it as much. But then he's like, oh yeah, it's like that common, and I was like, wait, what? This is like that unheard of in the United States nowadays. But it like during the Cold War, it was like one of the most prescribed drugs ever.
Yeah.
It's just that's kind of crazy that they somehow like the people with epilepsy didn't go away. What did
a lot of people using? I mean, a lot of people died. A lot of people did die from epilepsy.
Just because of that?
Because of lack of, I mean, before we had all these new medicines, people would die from seizures. Yeah.
Really?
Yeah, for sure. It was definitely a cause of fatalities.
Oh, wow. I guess I'm just growing up in a world where it seems like it's a very treatable condition.
It is very treatable nowadays, but I mean, if you think like in the 30s, I'm trying to think 30s and 40s what they maybe even had. I don't know if Depakote was around then, but yeah, it was a bad disease.
Wow. I mean, I know I learned in school about like diabetes doing that and stuff.
Oh yeah.
I don't think we ever really, I don't know, like neurological stuff always kind of seemed like it was just to the side.
Yeah. Yeah, it's a serious thing. Let me just look and see if anything else is going on I should pay attention to. I know you've got a couple of notes since I saw you last time.
Okay, there's been issues with like me scheduling appointments. I don't understand what's going on with that. The scheduling people couldn't tell me, so I was gonna ask if you could see and just tell me what the like note says, just because like it doesn't seem like it applies to oncology, so it seems like y'all are totally different. I called my insurance company, and they actually rerouted me to y'all because my primary care physician's primary phone number for the federal government is now set to y'all's like receiving number. Apparently it's always been that, and I don't know why, but she didn't really have an answer. It was just, no, that's always the number, and then that number got me to y'all's scheduling, but I had just been calling on like, you know, a day that you guys probably had just closed, so that's probably what happened with that.
Yeah, I do see that you've had dermatology, neurology, and medicine canceled.
Yeah, I didn't know why.
I'll have to message our scheduler and see what happened.
Okay, because I got contacted like by what was expressed to me as a phishing and scam attempt through like LSU when I contacted their IT and then spoke to them verbally after email correspondence with their IT administrator, based off of like irrelevant. I didn't click click on the stuff. So I mean, like, I don't know what it was, but that happened in like November maybe.
Okay.
And then I also got like emails that came from like more legitimate means of like to where it looked like it was a legitimate email, I guess, from y'all's like email addressing for
Okay.
LCMC. But then again, I hadn't gotten an email from the LSU one yet,
Okay.
so I hadn't spoken to any IT personnel by that time. So I responded to that one. Maybe I shouldn't have done that because I should have probably just ignored it and considered it like the same level of spam, but I didn't. But like that's like kind of hindsight, I guess, because now I'm kind of just considering all future correspondence from in that regard as being kind of like irrelevant.
Well, let me see what I can find out.
Just because like since then I've just spoken to other like staff trying to schedule and my insurance and stuff like that, and insurance says my primary care physician on their end, it looks like it's all fine. It's still within the network and stuff. So since I now know there's like no changes, it just seems like there's some other thing going on.
Yeah, I'll see what I can find out for you.
Okay, thanks. So I just kind of have been hitting a wall myself, and I think it's something my insurance is expecting me to kind of coordinate with them because they were pretty concerned about it. It's very not okay with them, to like have the appointments canceled.
Yeah. I don't really see anything about it. The clerks may know more, but let me get with them and I'll let you know.
Okay.
What I can find.
Yeah, the general scheduling for LCMC like had they tried to be as helpful as they could, but they said that they couldn't actually tell me what the notes said, but I was given a date of December like the 9th.
Okay.
That somehow everything just got canceled.
Okay.
And that's what that date had nothing to do with any of the correspondence that I was given.
Yeah.
So or anything that I would have responded with.
Okay.
At all. It just was like that's just a random date to me. I looked and I think it was a weekend.
Okay.
So that just didn't make any sense. Like so to where that only kind of like since I've gotten that information too, that only reinforces that it's something else is kind of going on type of a deal to where nothing makes it's not just like it just doesn't seem legitimate of a thing. There has to be some other sort of issue, and that maybe all my appointments can just be like rescheduled through Oncology or something. Maybe that's what's gonna need to happen because I can't physically contact those physicians anymore. But it doesn't, and nothing tells me that they've gotten contacted.
Our clerk, Leah. I said he was wondering if the neurology, internal medicine, and dermatology appointments that were canceled can be rescheduled. She's really good. I'll see if she can figure that out for you.
Thank you so much. That would be great.
Well, like we've talked about before, I think from a melanoma perspective, things are good.
Okay.
No reason to do scans or anything going forward. I think the most important thing for you is just to have your dermatology exams done once a year. I think it's important for us to just touch base.
So you don't want to continue the 3-month melanoma checks like usual?
I'll leave that up to dermatology.
Okay, because usually they've wanted to continue the strict 3 months.
Yeah, because you actually had an appointment with dermatology coming up. That's going to be important.
Yeah, but that one was canceled.
Yeah,
because I did send because I missed the appointment in November, so right now I'm almost going to be like at 6 months without seeing them, and I understand like the one in November, that was my fault.
Right.
I had transportation issues and stuff, and communication problems with them, so I tried to reschedule that morning.
Right.
And I tried to not do that, especially for them, because I know they usually put like multiple residents on me as a team.
It doesn't. That shouldn't have led to them canceling your appointment, though.
I don't
future,
think so either. That just wouldn't make any sense.
Yeah.
But I did send them like the previous week photographs of some spots.
Okay.
And they did respond to me right before that all happened.
Okay.
But now I'm not even in my patient portal able to access that correspondence with those residents.
Ah, okay.
So it's like it disappeared.
Okay.
So it was like whenever I contacted you about this appointment to like make this appointment, because I had forgotten to schedule when we just like walked out asleep like it like I did last year. I see your correspondence with me, but I don't see their correspondence with me. And when I initially contacted you, I think their correspondence with me was there.
Okay.
I'm pretty sure, or it was like right before. So it showed that like I had sent them like the email, little thing in the patient portal attached as a file, the PDF of the little photographs of I think it was my left arm somewhere around here. The
Okay.
spots went away kind of, or like were less pronounced.
Okay.
So it wasn't as big of a deal.
Okay.
But there is now a spot kind of like on my, which shoulder blade? Like either here or here on like the right back shoulder blade or left back shoulder blade, whichever one I'd see on a mirror, if I was looking at it.
Okay.
And that I did kind of want to discuss with them, because that kind of has seemed like it's gotten a bit more, larger.
Yeah.
But the coloration doesn't look like what it looked like for the melanoma that I know of from the initial spot on my left ankle.
Yeah.
So I still don't really think it's anything important.
Okay.
But I would have liked to have been able to send them, just in the interim of like scheduling appointments,
Yeah.
another email, because doing that has really been helpful through the patient portal, and that actually is kind of one of my biggest concerns.
Yeah.
They get back to you so fast. They're like able to immediately tell you, as long as you take a high enough resolution photo, oh yeah, that is this or that isn't this, and they'll have like, and that's all I need to know really.
Yeah.
Just in case there's anything that happens, and we have to switch from like a 3-month to like a 6-month like visit with them.
Yeah, I mean,
because I don't need to do, if you don't think I should have any radiations-based scans anymore, like no more chest x-rays and stuff, that's perfectly fine.
Yeah, I think that's reasonable because you're so young and, we don't want to subject you to all that radiation over, another 50 years of life expectancy. So
I'm fine with that. Like I've already had what, like 40 full brain scan MRIs.
yeah, you've had a million images.
Yeah, they've got probably enough of me with that. The nurse did say that Dr. Lenajek had imaging tests listed as like his tests for me previously. I just wanted to make sure that, because he put in orders or spoke to me about orders for blood work, for the usual blood work I do with him, and I was supposed to have seen him, soon.
I don't see any imaging orders. The last image you had was an MRI of your brain from 2020.
Okay, that was that one. All right, then I don't need another MRI. That was an initial MRI for the epilepsy. And you didn't see any new blood work orders.
No.
Okay,
No.
then I probably got those in November. So
Yeah, we
probably
definitely
fine.
need to make sure you get back in with those guys, especially Durham. So I'll work on that.
Okay.
All right.
Thank you so much.
Good to see you.
Yeah.
Take care. See you in a year.
Oh yeah, that's cool though.
Yeah.
Yeah, that was the first thing I saw. That's cool.
Yeah, it used to be on the wall. I don't know how it fell, but anyway. All right. Good to see you. I'll see you in a year.
Okay.
And I'll message the guys about trying
Should
to
I wait
check
here? Or do I go
You can
out?
check out in the front.
Check out in front. Okay.
Yeah.